Okay, so now we want to look at the role of arterial sclerosis in blood pressure, or how high blood pressure can promote arterial sclerosis. Basically, when you're talking about high blood pressure creating arterial sclerosis, it's that shearing force that we know when you squeeze down on a water hose that has water coming out of it, it increases the pressure and it's more of a shearing force. Arterial sclerosis is basically aka hardening of the arteries, and with that hardening of the arteries you have a decreased elastic recoil. We can use the example of a rubber band, and when that rubber band has decreased elastic recoil, we have to remember that when you're talking about blood pressure, it's all about volume and recoil. If you don't have recoil, you don't have the ability to accommodate higher blood pressures. So higher recoil in a band like this will allow for that accommodation. When you get into thicker bands, you don't have the same recoil potential, and therefore the pressure within that system is a lot higher. So let's take an example of a thin elasticity and a thicker, and we'll see how it's a lot easier for me to put pressure into this one, and that recoil comes back, versus this thicker one. It's a little bit harder. So they both do have good elastic recoil, but the thicker it is, the less accommodation you have. So the more pressure you have in the system, the more of a shearing force you have, and therefore the more damage you get to that arterial system, thus promoting the arterial sclerosis. It's kind of a dog chasing its tail effect. So now we want to talk about interventions, lifestyle, and exercise, things you can do to help keep your blood pressure at safe ranges.